So good afternoon again, and just a short comment that I remember when 2 years ago in the first meeting of the Hungarian Pancreatic Study Group, Heiko asked the audience that how many pediatricians are there, and I think maybe 4 or 5 of us raised our hands, and there was no more, and now and 2 years later, we have the focus on the pediatric pancreatitis, and the INSPIRE study group is here, and thank you for coming, and we are so happy that you are here. And I would like to introduce you the other pediatric pancreatitis study next to the pineapple, as called APPLE. We know that for adults there is the evidence-based guideline for the treatment of acute pancreatitis, and but if we look through the literature, we can find really good papers from the INSPIRE study group, and we have a good up-to-date management for the AP from Mysham, and we also have really good chapters from Mark Love, and we try to follow their success. And so for adults there is the evidence-based management guideline, and for children, as we heard it in the morning session, and it's written in the papers and highlighted that further research and evidence-based studies are crucially needed. So we heard this invitation, and our aims met to disengage, and we organized the APPLE-R study, and this is for patients with history of pancreatitis under 18 years old. The aim of the study: understand our earlier practice in pediatric pancreatitis, specify the genetic background of pediatric pancreatitis, understand the family history in pediatric pancreatitis. The hypothesis is in those countries where the incidence of pediatric pancreatitis is lower, the chance for the genetic background is higher, and recurrent acute pancreatitis, chronic pancreatitis are more frequent than a single attack of acute pancreatitis. We have the APPLE-P study for the newly diagnosed patient under 18 years with pancreatitis. This is the follow-up study for the pineapple. So the pineapple study can help us to find those patients who can join to the APPLE-P study. The aim of this study is to get more details and recognize better the cause of the pediatric pancreatitis, specify the genetic background of the pediatric pancreatitis, identify early risk factors for the disease, as was mentioned by Aliyah in the morning session, the second-hand smoking, for example, and establish the severity at admission. It is also mentioned by Mysham, and it's also a really important question for pediatric patients as well. The hypothesis for the APPLE-P study is we will able to understand and characterize the early risk factors. We hopefully will be able to draft a score system which is suitable to predict the severity in acute pancreatitis, and we will understand the management of acute pancreatitis better. Why it's important to have this kind of studies? Improving the management of patients suffering from acute pancreatitis makes strong evidence which could help draft an evidence-based guideline for pediatric patients. So if you are interested in how to join, you have to fill out this sign. It's the intent to join to the APPLE study, and you have to send it by email to Andrea Párniczky. She is the director for the registry. The protocol for APPLE-P and APPLE-R is start with the intent consent form. You have to fill it and signed by the patient. And the APPLE-P study starts with a questionnaire, and it's really important to be filled at admission, because there are really important information which we are necessary to know at admission. This questionnaire contains the personal details, the medical history concerning the alcohol consumption and smoking, and not only for the children, it's also there is question about the mother and during the pregnancy whether the mother consumed alcohol or smoked. Also details about the medical history, what kind of other illnesses does the patient have. The etiological factors, we are first looking for those which can be treatable, for example, the biliary and for the other ones. And if the idiopathic etiological part is coming, the genetic background should be covered. We are still in the ER unit, and at admission we need the complaints and symptoms for the abdominal pain, the intensity, the duration, and other complaints, vomiting, appetite loss, nausea, bowel sounds, which are also really important at admission, and the laboratory parameters, and it also contains the inflammatory parameters and the status at admission. There are some questions about the imaging, ultrasound, and the pericardial fluids, and the lung fluids, and the X-rays. More questions in this questionnaire, which is still in the ER unit at admission, about the treatment, the intravenous fluid, and the enteral feeding, pain management, and the complications, multi-organ failure or death. And when the patient is transferred to the ward, there is another questionnaire for the everyday routine, and it's much more easier to fill in. It's just some really important questions are here, but it should be filled out day by day during the hospitalization. For the genetic analysis, we need 2 tubes with EDTA. You have to start in -20, and with all the forms and the blood should be shipped to Szeged. All costs are covered by us, so if someone would like to join in, it's not a money question. The general information about it, the number of patients in APPLE-R is 800 patients, and APPLE-P is approximately 300, and the auto-ship policy is, I think, really nice, because 5 patients is 1 auto-ship for both studies. We would like to do the study 2 or 3 years, and the ethical issues approved. So just a small summary for the studies, and you need the letter of intent to join to the APPLE study. For the APPLE-R is the study for the patient with history of pancreatitis, so the adult GI departments are also invited here, because it doesn't matter how old the patient is now. It is important that the first episode happened under 18 years. APPLE-P is for the newly diagnosed patient, and as I mentioned, and as Fanny mentioned, the pineapple study could help us. For the APPLE-R study, there is informed consent form, a really simple questionnaire. We need 2 EDTA blood samples, and for the APPLE-P, also the informed consent form, really detailed questionnaire, but is so necessary to know what's the situation at admission. And there is the everydays form and also need 2 EDTA bloods. All the forms and the study protocols are available on our webpage, so you can find it. And as I know, one of the copy is in your folder, and you can see it. Thank you for your attention, and I'm happy can I answer your questions.
Have you got any questions or comments?
So, for the history of pancreatitis, before 18 years of age, I mean, are you looking for documented pancreatitis episodes or just having a history? I mean, should the pancreatitis be documented, like with amylase and lipase?
Yes.
Or you would just take a history?
Yes. Yes.
I think it will be a problem with the informed consent for the adult patients or older or in the retrospective study. It will be a problem. Of course, for prospective, it's not a problem. You've got a patient, you've got an informed consent, and it's not a problem. But for the retrospective study, we take this for the patients which were 10 years ago when they were a child. It will be a problem.
So actually, I think the other study is not a classical retrospective one, because it's a retrospective view of the pancreatitis. So if someone has a database...
The data from the 10 years ago, it will be a problem. Because it's possible to have a data of the patients from the 2004, it's 10 years ago. And to take this informed consent will be a problem.
But maybe I don't understand correctly, but...
I guess if...
It's a problem to take a historical informed consent for the patients which were hospitalized 10 years ago.
But we get the ethical approach,
Right,
so we can do it. And when, for example, there is a database, and the patient now is, for example, 35 years old, and the first episode was when he or she was 6, and someone find this patient and ask to come to his office and fill the forms and sign the
I guess that could be a problem.
It will be easier for Poland when we got 500 kilometers from the center. It will be not easy to call for the patient just come to sign this informed consent.
But
So you got the patient to all the
there are no hospital in this. Sorry.
So I guess with every database, that's probably one of the negativities, or could be a limitation factor. Like in the database that we have, we ask the patient to recall the number of episodes that they had. The family has to recall how dysfunctional they are from the pain. And, you know, there's nothing better than prospective studies and prospective data collection, but that is registries and database. So I guess for that standpoint, it's probably going to be okay knowing that the limitations of it. I had actually a comment for you. So it looks like the apple is more than the clinical trials, but it's a prospective way to collect the information. That's why it's part of the clinical trials. But you are actually going to collect information, so the parts that are dear to my heart, the severity and the management. You're going to capture the information of what IV fluid they got, what's the type, what's the rate, day by day, which is great. The problem that I could see happening down the road is that you're not going to be comparing apples to apples. So that's one of the things where one patient is going to get, you know, D5 half an S, one patient is going to get LR, different rates, normal saline. So yes, with increasing patient samples, you're going to overcome that, hopefully. But also the patients who got those different IV fluid types, some of them were not fed early, some of them were fed early. I really see that we have to move to prospective randomized controlled trials. I really feel that with collaboration, we should just, I'm going to start one for nutrition. Once I announce it, I will call for centers. I would like to design one just for IV fluids. It could be a simple and stupid design. It could be just, on admission, you have acute pancreatitis. If you're not hacking up blood and you're not in renal shock, I want to enroll you. And then if I enroll them, I'm going to randomize them to lactated ringer or normal saline, and just really just following prospectively and treating those patients in a way so that we could just compare. But great work and great presentation.
I absolutely agree with it. You are totally right. But first, I think we need to have easy to identify the centers who is able to be involved in randomized trials. Because those centers who never ever filled in a questionnaire, even we can bring in, we can see, because we have now 31 centers. And Andrea is here, the director of the data issue, and she can tell you, by days about the problems, and the questions, what came from small hospitals. So first we need to learn how to fill in a form, how to keep the correct issues. And these kind of studies are the best ones because they don't need to change their practice. They do whatever they did. And even if there is a big difference between getting fluid, not getting, we can get results. But this is like a learning phase, I think, which is very important. When you ask us to join in, we can say we have 31 centers, 4 are capable to join this randomized trial.
Thank you very much.